President Kikwete remarked, smart and targeted investments can transform Africa's response to malaria. Thank you very much for that. Now, encouragingly, recent analysis from the African Union Commission, ALMA, and the RBM Partnership to End Malaria indicates that several African countries have markedly increased their domestic resource commitments to malaria since 2018. It's a good time to discuss how this has been achieved, examine what still needs to be done, and also how all parts of society can play their part in this effort. So please welcome to our esteemed panelists. We've got Madam Joy Mfumafi, who's Executive Secretary of the African Leaders Malaria Alliance, Dr. Margaret Agama Anyente, who's the Acting Director, Directorate of Health and Humanitarian Affairs of the AU Commission, Ms. Olivia Ngu, who is Executive Director of Impact Santé Afrique, and Ms. Eunice Elvire Loisel, who's the Director of Commercial Banking at Ecobank Benin. A big welcome to all of you. Let's begin with you, Ms. Mfumafi. Because of the COVID-19 pandemic, we have seen significant private sector investments, both in terms of donations and spending to protect employees and customers. Why do you think companies have been so willing to invest to combat COVID-19, and what lessons can we learn from this?
Thank you so much, and I welcome, like you have and His Excellency has, everyone to this third anniversary of Zero Malaria Starts with me. Indeed, the answer to that is that we have seen political will, political commitment, empowerment of the community, and action and investments amongst different stakeholders in the community that in the economy that are equally important in the fight against malaria. We have witnessed 20 countries launch Zero Malaria Starts with Me campaigns. And from these efforts, new multi-sectoral community-based initiatives have taken place. These include the End Malaria Councils and Funds that His Excellency talked about, parliamentarian forums, increased participation by the private sector, and accelerated devolution of public sector, increased community mobilization to address malaria. We have also seen the successful replenishment of the Global Fund, which is a critical mechanism for mobilizing financial resources in the fight against malaria. However, we must acknowledge that we face a different world shaped by the COVID-19 pandemic than we did 3 years ago. And we have seen unprecedented global attention and investments in health over the past 18 months. So we must learn lessons from this as well. We have been able to learn that the global community can adapt. We're being able to adapt to new behaviors, wearing masks, regular hand washing, physical distances. We have developed an array of new vaccines, including mRNA. We can learn from this in the fight against malaria. We have also been able to see the health impact in real time on well-being, people's well-being, the economy, education, infrastructure, and development as a whole. So we must learn from this. And on the malaria front, countries have adapted new COVID-19 safe approaches for vector control campaigns. So the message is clear. We can save lives. We can defeat diseases with adequate political will, community mobilization, and resources. But most importantly, engagement of everybody, political leaders, social leaders, religious leaders, financial leaders, private sector leaders, youth leaders, traditional leaders, leaders in every front, working together with our partners.
And you're right.
So the message, yeah, thank you.
Yeah, that sustainability is key to this. So how can we sustain private sector prioritization of health and use that to drive greater spending on malaria? And of course, recently, the African Union launched a common market and has pledged to drive greater economic integration across the region. How do we include malaria control and elimination on the continental and regional economic agendas?
Well, I think what has become absolutely clear is that fighting smart investments in health actually pay dividends, yield dividends. We have evidence that shows that there's a 60-to-1 return on investment across the African region for malaria investments. And we know that we can actually gain 1.3% annually in growth, in economic growth, if we invest in malaria. So it is now time to take these lessons that we have learned and actually implement the disease elimination process. We know that 500 million days of work are missed each year in malaria endemic countries across the continent. This is huge in terms of the impact on the economies at rural and national level. So when we come, this trade agreement that we have come, opening up our borders, it will not help us if we do not also have cross-border elimination efforts to ensure that there is an integrated, complete Zero Malaria Starts With Me effort across the continent that ensures that our economies do indeed grow with these new efforts, and that this disease does not continue to impose a burden on our economies and, of course, on our front line health workers who carry the burden, as you know, of care. When during the malaria season, most of the sick people are suffering from malaria. Even if they do end up recovering, except for under 5s, it is a huge burden on the frontline health workers.
That's so true. That's so true. Moving to you, Dr. Margaret Agama-Anyante. I hear you just landed somewhere. So welcome back to the ground. You've just heard Joy there mentioning 1.3% annual growth is possible. What is the position of the AU Commission on public-private sector engagement within the context of health financing? Doctor. Oh, have we lost her? Is she not with us? Perhaps not. We'll come back to you, Dr. Margaret, when you do join. Moving to you, Ms. Olivia Ngou, Executive Director, Impact Santé Afrique. You had an ambitious NGO working with different players, creating synergies towards efficiency and inclusivity. It would be good to get some concrete examples of an action led by civil society on domestic resource mobilization for malaria in Africa. What can you share with us, Olivia?
Thank you very much. Thank you, RBM, ALMA, and other partners for having this important webinar at this time. So I'm happy to share with you some concrete examples, starting from Niger to Nigeria to DRC. Many civil society organizations are very involved in domestic resource mobilization. It's just that those organizations, they don't have the whole communication teams to really communicate about the great work that they are doing on a daily basis. They're meeting with parliamentarians, they're meeting with mayors, they're meeting with private sectors, they are meeting with local leaders to ask for an increase of malaria funding. And one concrete example is just in Cameroon, and we also want to congratulate the National Malaria Control Programs of Cameroon and the Minister of Health of Cameroon, June 15, through the initiative of civil society, Impact Santé Afrique, which is the NGO we work with. We have launched the first parliamentarian task force for malaria resource mobilization in Cameroon. And during this meeting, the meeting was chaired by the Minister of Health, and we had parliamentarians, deputies and senators present, also partners, PMI, the National Malaria Control Programs and others in the room. And we were able
to... The joys of online life, Olivia.
Yes, hello.
You're on, you're on, we can hear you. Not to worry, we can hear you.
Sorry. So we were able to sensitize, mobilize senators and parliamentarians. And the good news is that they have decided to create this task force and to launch a working group that is going to ensure that the national budget for malaria is increased, and particularly ensuring that the countries meet their co-financing requirement for the Global Fund cycle. And this was very important to ensure communities have access to malaria services that are essential for prevention, diagnostic, and treatment. But also, we also talk about the gaps of the National Malaria Control Program that needs to be filled, around 100 billion of franc CFA that the country needs to fill. And we are also very proud to announce that working together with ALMA, with the National Malaria Control Program, and with the Cameroon is right now about to officially launch the End Malaria Council and the End Malaria Fund, which will be another tool to increase domestic resources. So civil society role is very key, demanding our leaders, the leader we elected at those positions, to increase, to walk the talk and increase malaria funding. And this is actually happening, and we are very happy to see that commitment. And the next step will be for civil society organizations and ourselves to work on accountability, to make sure we keep our leaders accountable, and we monitor every year to make sure that those resources are mobilized. But also there will be a sub-commission at the parliament that is going to follow all the engagement taken by the government on malaria resources, and also making sure that those funding are used correctly, because it's very important that the funding that we are asking for, the increase of resources, are being used correctly. And for example, we are asking Cameroon to prioritize the support of community health workers, and making sure that we extend the coverage of community health workers, but we also fill the gap in terms of malaria testing, treatment, and mosquito net that communities are going to need over the next 3 years. Thank you.
Now, interesting. I mean, you're talking there about accountability and funds being used correctly. What have you found is needed to enable civil society to really strengthen their role and their actions in domestic resource mobilization? What more have you seen in your different examples?
Yes, what is needed is to equip civil society with technical skills, because we need to go from the informal advocacy to really professionalizing this new field for civil society, making sure that when we meet with our leaders, we have opposition papers, we have evidence, we have collected data, we have shown the gains in terms of how much the country is going to gain when we invest in malaria, when we invest in community health workers, when we invest in mosquito net. We have to equip civil society to be able to come up with concrete evidence, because we are talking with leaders who are technically sound, and we need to be technically sound as well. And on that, we are actually now working with RBM, with Global Fund, Global GFF, and Gavi on a joint learning agenda. Currently, about 40 trainers are being deployed in 20 countries in Africa, training civil society organizations on how to actually make sure that we professionalize advocacy, and specifically training them on health budget and health budget processes, how the health budget is being made at the country level, who needs to be influenced, when are the key moments, who are the key players. So the whole cycle around health budgeting is very important to equip civil society with those information, so that when they are in front of leaders, we can actually be as technical as possible, and make sure that we speak their language and we understand each other very well.
Yeah. Very salient points there. Dr. Margaret, can you hear us at this point? Or are you able to join us? I think she may be having some problems with sound. Okay, we'll still come back to you. We're keeping you, still got some questions for you. Moving to you, Ms. Eunice Elvire Loisel, Director of Commercial Banking, Ecobank Benin, a Pan-African organization. We're a Pan-African effort. This certainly sets the pace for other companies like yours to follow. Tell us about the Zero Malaria Business Leadership Initiative, and why Ecobank has decided to invest their energy and resources in the fight against malaria.
Bonjour à tous et merci de me donner l'opportunité de m'exprimer sur l'initiative Zéro Palu, les entreprises s'engagent. En effet, l'initiative Zéro Palu, les entreprises s'engagent, a été lancée à l'occasion du deuxième anniversaire de la campagne Zéro Palu, je m'engage, le 2 juillet 2020 par le groupe Ecobank, le partenariat RBM pour mettre fin au paludisme et le partenaire Speak Up Africa. Et comme vous le savez, en juillet 2018, les chefs d'État et de gouvernement de l'Union africaine ont lancé à l'échelle du continent la campagne Zéro Palu, je m'engage. Et cette campagne repose essentiellement sur trois piliers que sont celui de l'engagement politique, de l'engagement communautaire et enfin de l'engagement du secteur privé. Et donc, c'est dans ce but de soutenir le deuxième pilier de la campagne Zéro Palu, je m'engage, que Ecobank a décidé de s'aligner aux côtés de l'engagement politique. Alors, les entreprises s'engagent, ça a été conçu pour stimuler l'engagement du secteur privé dans la lutte contre le paludisme en Afrique, tout en plaidant pour une volonté politique plus forte, un financement accru et des stratégies d'élimination du paludisme un peu plus ciblées. Alors, les trois premiers pays à avoir lancé cette initiative au niveau de Ecobank sont le Sénégal, le Burkina Faso et le Bénin. Et trois autres pays se préparent également pour le lancement cette année, le Ghana, l'Ouganda et puis le Cameroun. Alors, précisons que le Bénin a été le premier pays à avoir lancé cette initiative, notamment le 17 novembre 2020, en présence du ministre de la Santé du Bénin. Alors, nous avons décidé d'investir notre énergie dans cette lutte parce que, d'abord, dans le groupe Ecobank, Ecobank a fait de l'impact social l'un de ses principes fondamentaux. Alors, vous savez qu'on est dans 33 pays africains. Donc, Ecobank opère dans 33 pays africains. Laissez-moi vous dire donc que le paludisme a un impact assez négatif sur notre personnel, les familles, nos clients, notamment les chefs d'entreprise et nos communautés, donc entraînant ainsi un affaiblissement du système économique. Alors, la maladie continue d'affecter les bénéfices des entreprises à travers le continent et au-delà par le biais de l'absentéisme donc des employés. On observe souvent une baisse de la productivité et puis une augmentation.
We see the increase of health expenses, and with the participation of the private sector, 72% of business leaders indicate that this had a negative impact on the private sector. Therefore, many this indicates the crucial participation of the private sector at the national level by mobilizing the most partners and resources. Malaria reduces the increase of the payment, and investments in this sector is indispensable to have strategies at the national level, and this has shown a positive result in the 30 countries with $20 billion, additional $20 billion in these countries will be able to protect populations that are exposed to malaria. With the participation of the private sector, it's clearly seen that malaria has created many partnerships at the continental level in order to have sustainable financing. We need to eliminate malaria in order to have sustainable economies.
Yes, that's correct.
Discussions are crucial, and mobilizing resources is indispensable. It's important to say that in all countries where this initiative has been launched with the participation of the private sector, we work in collaboration with ministries of health and other partners in order to ensure that the project is very well adapted to the needs of countries.
Okay, and just so that we can understand this really well, in Benin, what are the main actions undertaken to engage the private sector in financing the fight against malaria? And what are your plans for the future?
Thank you very much. Allow me to tell you to give you a few numbers before replying to your question. In 2019, 200 million people are affected by malaria in 87 countries. This has caused 409. We have lost 4,009 lives in Africa. 275,000 people have been affected by malaria in 2019, with 34 people who have lost their lives, and 53.3% of them are girls from 1 to 4 years. In 2019, 1.3% of the population is affected. Malaria is a real public health problem.
Yeah.
It is also the first reason of hospitalization of children under 7 in our health facilities in Benin. The need of financing in 2019-2020 for the fight against malaria is estimated at 130 billion CFA francs. That is 80% of the budget allocated to priority diseases in Benin. We work to mobilize the private sector so that they may be able to support the initiative and forge partnership to mobilize resources and finance the national fight against malaria. We have established a partnership with the national program of the fight against malaria, and in this respect, many engagements have been established. In November 2020, we have organized with the private sector that is engaged in the fight against malaria in March and April with an increased participation of the private sector, an initiative that benefited from the participation of the CNLS, the state, that had 20 clear projects defined by the private sector to better support the national fight against malaria. And it has been the occasion to obtain funds from the private sector. Today, the private sector is engaged and are even champions against the fight of malaria. Mr. Esperandosa is the director for the development of this project. Madame Annabelle, that is the director of Kangezo Pharmacy, an honorable deputy member of the General Assembly and president of the Commission of the Education, Employment and Social Affairs, were part of this initiative. The private sector participates actively to the activities organized by the Ministry of Health. So our project regarding this initiative is that we are actually establishing an official project that has been launched with a contribution of $120,000 that will be utilized in each country. And this fund will be used in concerned countries. Communication works are underway. This initiative is named Palu Tech, so that mosquito nets be distributed in pharmacies and be sold at reasonable price for the population. We are also organizing at the time being a national telethon for the public, for the participation of the private sector, and better mobilize resources and fight against malaria, while encouraging contributions to this campaign. What we should remember is that we are very happy of the works we're undertaking in partnership with Speak Up Africa and the AUC with this Zero Malaria Starts with Me campaign. Coordinated efforts are needed to fight against this, fight against malaria.
Thank you so much there, Eunice. We just want to see whether we can go back to Dr. Margaret so we can get a few of the comments, or at least a perspective from the African Union Commission before we go to our Q&A. So thank you so much. Dr. Margaret, are you with us? Have you been able to join? Well, she's certainly there, but on mute. So, well, we'll need to move on to the Q&A because we've got loads of questions coming in and some comments, of course, that are coming through on the chat line. Mary Okumu, what are the opportunities for private sector in terms of value proposition for their business, leaving out health benefits, which is core? The key to private sector involvement is in any activity is value proposition. Thank you so for that, Mary. That's very true. Let's go back to you, Joy. We've got a question here for you. Private companies are continually looking for emerging markets, either for growth or to expand their manufacturing. How will combating malaria make markets more attractive for private sector investment, and how do we entice companies to support these efforts? Mary was there talking about value propositions. What would you say?
Well, absolutely. I mean, for potential investors, when you invest in an economy where you know that there is no malaria, particularly you talk about the tourism industry. A lot of us countries in Africa rely on the tourism industry quite heavily. If any country that will be able to guarantee that we are malaria free would be very, very attractive to tourism. Yeah. But for existing investors as well, it's not just a question of increased consumer and employee loyalty, but it is attraction and retention of a top workforce talent. Women are the caregivers, and women are normally the ones who are going to be caring for people who are sick from malaria, and they are also the top performers in most industries. So you'll be able to guarantee retention of this top level workforce, and of course a healthier workforce pool, a healthier community will ensure that you have a healthy workforce, to recruit from, and improved learning outcomes in academic institutions, in schools, will ensure that you get a quality workforce now that comes and works for you, in industry. It improves worker morale, job satisfaction, increases productivity, engagement, and loyalty of your employees, and also reductions in direct costs, because you are going to pay as an employer higher premiums for health insurance if your employees are constantly sick. So it reduces the burden on you as well as an employer of what you actually pay out. And then there's a corporate image, improved community support and relations. So it's a real win-win for the private sector.
It truly is. It truly is. Another question has just come in for you, Joy. It wasn't French. It's been translated for me, and I might read it a bit, and hopefully I've got it right. It's about seasonal malaria chemo prevention. What are your comments on this approach, which is recommended by WHO, has been recommended by WHO since 2012? And this question can actually go to Olivia as well. So, Joy, you could start us off again, or Olivia, please have your camera on as well. so that you can respond to that question.
I'll just, respond briefly so that Olivia can chip in.
Sure.
Beautiful intervention. Last year, across the Sahel, the implementation of this seasonal malaria chemo prevention, despite COVID-19, actually protected 20 million children across the Sahel. Wow. Beautiful intervention, and with really great outcomes for communities.
Fantastic. Olivia? It seems like our panelists have dropped off. Olivia and Eunice, please, can we have your cameras back on, because we've got some questions for you from the audience as well. But whilst we are on this, we've seen encouraging signs with regard to domestic resource mobilization. Joy, what are some of the things that this money is invested in? Insecticide-treated nets or seasonal malaria, as we're talking about chemo prevention, as an example. Where do the greatest gaps lie, do you think?
Well, in countries like Zambia, where I think you'll hear about that later on, they have been able to invest in transport, the private sector donating vehicles for transportation. They have been able to fund mass drug administration, which is one intervention which some countries are engaging in that protects the whole community, against malaria. I mean, in Eswatini, they've been able to buy mosquito nets. So the good thing with this councils and funds is that they actually rely on the data that is collected by the malaria program, and together they sit together as partners to identify where the gaps are and agree where the greatest need is that they can support. So you end up with a coordinated, comprehensive approach to addressing the malaria pandemic, following the national strategic plan, that then makes it much more effective than if companies or the private sector were engaging on their own in an ad hoc manner.
Yeah. Eunice and Olivia, are you there? I did speak to you not too long ago. We've got some questions for you.
I am here. Eunice is here.
Yeah, please turn your camera on, and Olivia as well, please. Thank you very much. Eunice, a question for you. Why should the private sector invest in malaria control, and how will greater investment in health transform African economies and businesses? That question was for you specifically, obviously wanting to hear the Ecobank goal from a business perspective. Go ahead, Eunice.
D'accord, merci beaucoup. Alors, comme je l'ai indiqué dans mon développement, ce qu'on constate depuis toujours.
As I indicated previously, I would say that populations give the sole responsibilities to the government, but we
can't do that.
Are impacted by the consequences of malaria. I had insisted on this during my presentation. Many people are sick, become sick, children are sick, and members of the family become sick. When these people are sick, we note that I will not go to work. When I'm sick, I cannot work. I cannot interact with clients, and this has an impact on companies' productivity. So that is why, within the context of this initiative, we associate businesses. Apart from the actions that are taken by states and governments, companies that work with us, I have more than 10,000 companies that are clients and that are my clients. These companies are engaged with us in order to support our initiative. It's in this context that we intervene heavily at the social level, and we say, why when this initiative has been presented to us, we said, why not? Why not work with RBM and other partners? So we organized many events and information sessions for the private sector, for them to understand the situation and support us.
Makes total sense.
And that is why they contributed for the launch of this initiative, and many more are joining us.
Yeah. I'm glad to hear that.
I hope I've responded to the question.
You have, Eunice. Thank you. Olivia, I'm sure that after our conversation today, it'll inspire many others in advocacy and communications to get involved in the Zero Malaria Starts With Me movement. Olivia, share some essentials on what they and how they can get involved.
Yes, it's very important to get involved because this is our problem. This is our African problem. We have many leaders and community asking us every day, why is it that we don't have a malaria vaccine when we were able to have a multiple COVID-19 vaccine? And what we tell them every day is because you didn't ask for it. So we need to ask for it, and then you actually get it. So it's important for everyone to ask for what the community needs at the moment. And at the moment, we are seeing, unfortunately, increases of malaria cases in Madagascar, in Cameroon, in several countries, in DRC, at the moment during this COVID-19 pandemic. And we need to be able to ask for everyone to actually start refocusing on malaria and having malaria back into the conversation, and making sure that we provide mosquito net testing and treatment to communities that actually need them, because we are living right now in a moment where we may have a silent epidemic of malaria, and we actually found out later that this was actually worse than the current pandemic for many malaria countries. So each person needs to actually be engaged. I think it's a personal, it has to come from within. They really have to believe in the cause, and we found out that when they really believe in it, they're actually able to give us even more than what we asked for. So it's critical for each person to look around, look at how many people you know in your family, in your community that have had malaria over the last 3 months or the last six months, and think about all the people who have had malaria but not have access to actually quality treatment in a timely manner. Think about them, and I think this will actually help every single person to get to engage and to start demanding to their leaders and also to their community to step up and eliminate malaria, because it's time we really mobilize all our efforts to make our whole continent malaria-free.
Malaria-free.
Yes, and we congratulate China. Many leaders asked us yesterday how China did it. They call us, the senators, and call us to ask how China did it. And we're like, because they prioritize malaria, because they did what they needed to do in terms of their strategy, and you can do the same. So so we should all be inspired by those successes, and we should make sure that internally we are actually committed to the fight.
And you're right about raising your voice, because there's a comment here from Andre who says, in other diseases, mainly chronic diseases, the voice of the patient is loud. Why is it not the case for malaria? So yes, we need to raise our voices on this. Thank you very much to our expert female panel, which was just great to have, and for the attendee questions as well. Now, before we turn to our second panel, let's turn our attention to see how we can best achieve the shared vision of zero malaria. If you could have the video on, please.
Sanbonani. My name is Stephen Mtetwa. I'm the director of the End Malaria Fund in Eswatini, a fund that was established by His Majesty the King of Swati III. In this video, I will briefly discuss what is an End Malaria Council and Fund. Countries have made significant progress in the fight against malaria, and the African Union has set a target of controlling and eliminating malaria by 2030. Successfully ending malaria, however, will require that malaria remains a national priority, that the communities and individuals are empowered to take action, and that the national malaria programs have the necessary capabilities and resources to overcome various bottlenecks and gaps.
To address the resource gap, I will strive to establish at least 15 national End Malaria councils and funds to boost high-level multi-sectoral engagement and advocacy and enhance domestic resource mobilization, including from the private sector of the continent.
End Malaria councils and funds are country-owned and country-led structures composed of senior leaders from each sector, inclusive of government, the private sector, and communities which work in partnership with the Ministry of Health and National Malaria Program. End Malaria councils and funds are being implemented by countries across the African region.
Today we launch the first National End Malaria Fund.
The President found it important that he constitutes the End Malaria Council
para financiar atividades contidas no Plano Estratégico Nacional da Luta contra a Malária.
The composition of this board cuts across different sectors.
That with the inauguration of the End Malaria Council and Fund, we'll be able to work together and achieve our goal of eliminating malaria.
To address this issue, the South African National Department of Health, under the direction of the Director General Dr. Abutelezi and Goodbye Malaria, have agreed to establish the End Malaria and NTD Fund.
The councils and fund members are senior leaders drawn from each sector: government, the private sector, and the community. Public sector members could include government ministers, principal secretaries, parliamentarians, sub-national governors or mayors, and leaders of parastatals like national banks or the Revenue Authority. Private sector leaders include senior business executives and leaders of trade organizations like the Chamber of Commerce and Industry. Community leaders could include executive directors of civil society organizations, religious leaders, and traditional leaders. EMCs and EMFs focus on 4 key areas. Firstly, the advocacy to ensure malaria remains high on the national developmental agenda and is a priority across all sectors.
And for members of parliament, this is where we hope you can also join the fight.
Secondly, action to prevent the transmission of malaria and help the National Malaria Program implement the National Malaria Strategy.
I have fever, body pains, headache, and nausea. I don't want to die.
Thirdly is resource mobilization to close budget gaps, especially from the domestic private sector.
And we used the expertise of the fund to manage to get it down, so we were able to procure it for 265,000.
And lastly, the accountability for achieving national targets for malaria control and elimination.
We only have been able to meet 61% of the need. In case management, where we talk about diagnostics and treatment, 81%.
For more information, please review the toolkit available at scorecardhub.org. Zero Malaria starts with me. Zero Malaria starts with you. Zero Malaria starts with us.
Zero Malaria starts with me. Zero Malaria starts with me.
It certainly does. Now, I can see loads more questions coming in on the Q&A chat box there. So we may not get a chance to be able to address each and every one of them, but I would recommend that our panelists from the previous panel, and of course the panel that I'm about to introduce, can answer live on the box as well, just in case I don't get an opportunity to read it out. Now, 20 countries to date, and a total of 15 EMCs projected to be established before the end of 2022, in line with President Uhuru Kenyatta's ALMA Chair legacy goals. It's great to see how End Malaria councils and funds are taking root, with countries making it a national priority that involves all members of society. That is the drive that is needed, and which brings us neatly into our second discussion centered on in-country experiences and achievements and in setting up EMCs and funds. Please welcome our panelists, Dr. Willis Akwale, the chair of End Malaria Council in Kenya and ALMA senior advisor, the Right Reverend Bishop David Njovu of the Anglican Diocese of Lusaka, Zambia, and co-chair of the Zambia End Malaria Council. And we've also got Member of Parliament Gabriel Jr. From Mozambique, who's also the director of the Secretariat Fundo da Malaria. As a way of getting us started and looking at some of the available information, in Eswatini, the EMC procured anti-malarials following a national stockout and provided funding for salaries of indoor residual spraying operators. In Uganda, the EMC engaged more than 100 companies to request support to close funding gaps in the National Malaria Strategic Plan. Let's begin with a 1-minute thought or 1-minute summary from each one of our panelists. How can End Malaria Council and funds support initiatives like Zero Malaria Starts with me? Dr. Willis, I can see you there on camera. Would you like to get us going?
Yeah, thank you very much, Patricia. Thank you for this invitation. Very useful discussions going on here. And for us, I think End Malaria Council are already proving to be very good catalysts towards local resource mobilization and the advocacy efforts within the African continent. And for me, especially considering the resources within the African continent, we now have an opportunity to harness them for malaria control and elimination. Thank you.
Thank you. Gabriel, I saw you there a minute ago. I'm calling up my panelists. Where are you? I'd like to see you on camera, please. Perhaps you can continue with you, Willis Akwale, Dr. Willis Akwale, with my next question again. Very briefly, how have development partners supported your End Malaria Councils or End Malaria funds? Has Willis dropped out as well? No, Willis is there.
Yeah, kindly repeat the question.
How have development partners supported End Malaria Councils or End Malaria funds?
Yeah, so development partners are very key, especially in the area of ensuring that there's this connection between the local authorities and the international organization like WHO, UNICEF, in areas of meeting the global manufacturing practices, in areas of assessing markets, and ensuring just the quality of the products that will be put. And also, more importantly, to map up resource. So if Global Fund is giving this and supporting this, which are the areas where there's not enough resources to tackle malaria? I think they have played a big role in that.
Great, great, great. Gabriel, I can see you there on camera. Your quick 1-minute take on how can End Malaria Councils and funds support initiatives like Zero Malaria Starts with me? I think we'll probably need Gabriel, go ahead.
Muito bom dia a todos.
Good morning to all. It's a great honor to be here and share with you this great moment and see that we have several leaders here. Several leaders here that have a mission of transforming our country in a malaria-free continent. And it's a great honor to be part of this webinar and meet people that will inspire me and with whom I will learn a lot. And I will get lessons of what I will use, what we will use in order to turn our malaria fund in Mozambique into a stronger malaria fund. And one thing that I would like to share with everyone is exactly how do we transform this idea, this concept of a malaria fund in Mozambique, because as you all know, we had Mozambique, a cyclone in Mozambique that has destroyed the center zone, practically destroyed it, and left us in a very difficult situation. And at that time, we started having a gap in the Ministry of Health, in which we tried to see how we could fight against malaria. And at that time, we saw the importance of having a movement inside the country in order to get support in order to fill some gaps that we still had in the National Malaria Program in Mozambique. And that's when we started to look for support movements within the country. And together with some private society organizations and other malaria programs, we were able to get $150,000 in order to support the Malaria National Program. And it was exactly at that point that we woke up and we saw, well, it is possible to find support, funds internally.
And that's great. It's wonderful that you can do this. But what role can fellow members of parliament like yourself, because it's about the leadership and leading from the front and leading from below and leading from around, play in this goal, to end malaria. If you could also share just 2 priorities with the Parliamentary Forum in Mozambique, please. Let's just try and keep it as simple and as clear-cut as possible, because we don't have much time, Gabriel.
Muito obrigado. Muito obrigado.
Thank you very much. Thank you very much. Actually, indeed, one of the issues that Parliament was debating is that what was a priority in terms of health, HIV or malaria? And initially, we created a forum that focused only on HIV until we found out that deep inside malaria is the disease that causes the most number of deaths and that most removes workers from their workplaces. And at that moment, the government of Mozambique and the parliament observed the importance of creating a champions forum in the fight against malaria, so that we can turn this objective into a common objective.
That's brilliant. And then what are some of the priorities within this Champions Forum? I like that, Champions Forum.
A primeira prioridade é advocar.
The first priority is to make an advocacy work on malaria, create the conditions so that there is bigger opening, and so that other organizations that want to help Mozambique in the fight against malaria can join, and then that there is more intervention, and also to promote among leaders, local leaders, government leaders, traditional leaders, and advocate together with them towards the need for having a champion everywhere, the need for all of us to be a champion in the fight against malaria from the bottom to the top. And one of the issues that is on the table now with the Parliamentarian Forum is the issue and the question of how can we include all of the organizations also in the private sector, so that the private sector, these organizations can also help us in this fight against malaria, because we want to have our greatest goal in 2030.
That's so correct. You're talking about all sorts of leaders. Let's turn to religious leaders as well. The Right Reverend Bishop David Njovu from Zambia. The EMC there has mobilized, $500,000 for mass drug administration in target districts from the private sector, and have been very proactive in sustaining malaria on the national agenda, despite the COVID-19 pandemic. Right Reverend Bishop, what has been the experience and the challenges of promoting malaria during the pandemic, and what lessons have you learned?
Right. The first and foremost challenge of sensitizing the people during the COVID period, especially in the 2020, we didn't know how to go about it. But with more information on how we could protect ourselves from contracting COVID, then we were able to use that information to go into the community and start doing our work. And the most biggest challenge that we experienced during that time was that the attention diverted from all the diseases and it went towards COVID. And because of that, malaria was put at the back. And nobody was really talking about malaria. Each one was talking about COVID. But later on, we picked up the courage and we said, even during the COVID period, we are going to do we're going to continue with the work of malaria. One, we decided that we were going to use the television, the radio, the social media in order to reach out to the people. And fortunately enough, we have the private sector, the Zambia Revenue Authority, who bought time for us. We have the airtime to do it on television. We have also Isdale Flowers, who helped us to buy our own time. Every Saturday, we have a program that is running on the national radio in order to disseminate the information. Furthermore, we have also now coming to the religious leaders themselves who have organized themselves, all the mother bodies, and we constitute about 97% of the population. So even during this period, COVID period, we are able to disseminate information on malaria as well as on the COVID. Fortunately, this year, for instance, the World Malaria Day was on a Sunday, meaning that most of those faiths that meet on a Sunday, we encourage them that their sermons should be based on how do we protect ourselves from malaria. And it had a very big impact because you are talking of all the religious, the faith leaders speaking on malaria on one subject throughout the country. And furthermore, on that particular day, we also asked that let every member contribute a 1 kwacha. Now, 1 kwacha is about 4 cents. It sounds very small, but it is a beginning of the commitment on the part of the members themselves by giving that 4 cents. And they see the work that the 4 cents will be able to do. It means next time they'll be able to give more. And because we have been so united now, we have gone out into the provinces where we are building the capacity of the faith leaders. And it's very encouraging to see the Christians, Muslims, Baha'i coming together. And at the end of the meeting, they are able to come up with the activities that take place in their own communities. So with these faith leaders, we have also promoted one thing, and that is advocacy. One of the reasons why malaria is proving to be a challenge is that there are fewer people who advocate for malaria. when we talk about COVID, there's been too much sensitization and advocacy to the extent that even the children in the schools, they know about the 5 principles of how they can protect themselves from COVID. And if the same can be used for malaria, we'll be able to see a progress happening. For instance, right now with the COVID, every day, the Ministry of Health, they are announcing new infections, people who have died, so that people know what is on the ground. In terms of malaria, we have to wait for the World Malaria Day or the SAGIC week in order to hear the statistics.
You're very right.
That is a challenge. But now we
let me just stop you there very quickly, Reverend, because I mean I see the comments here. Malaria is so common that it's become a norm, and people just take it as part of life. In some places, in many places, the comment has just disappeared, but thank you for that, Bissy. Let me just get Dr. Willis to make a comment here before we go to Q&A, Reverend. Dr. Willis, it's known that increasing local manufacturing of malaria commodities is a priority for Kenya's End Malaria Council. What are the biggest barriers to local manufacturing?
Okay, thank you, Patricia. That is a very important topic, and it is one of the sustainable ways in which we can progress African countries towards ending malaria. The lessons we learned from COVID-19 is that even if you had money and commodities were not available within your reach, you were not able to get these commodities for the use and protection of communities. So the focus towards local manufacturing, which is also quite a big focus here in Kenya, is to invest so that these commodities can be readily available to the communities that really need them, and that there will be reduced cost in terms of malaria control. There will be more ownership, and there will be more support for the countries. Of course, the challenge is how do we better coordinate these efforts towards local manufacturing? How do we maintain international standards? How do we ensure technological transfer? These are things that really need to be discussed. And I think it is an area that the malaria fraternity should be working so that we attract more people to invest in local manufacturing in countries that have a highest burden of malaria. Thank you.
Thank you so much for that. Okay, we need to quickly, move on to a couple of questions from the audience because we don't have much time for our Q&A. Reverend Jovu, the symptoms for malaria and COVID do have a lot in common. What efforts have been made to see to it that there is a high level of collaboration between the two? The importance of this cannot be underplayed, in my view, and borders on community preparedness to respond to the two. Tamara, from Tamara. Thank you for that, Tamara. Did you get that, Reverend Jovu?
Yes, I did. The first thing that we do, and we're encouraging the people, is that when they have the symptoms, they have to make sure that they go and be tested, because that is the paramount. And it's only when they are tested that they'll be able to know whether they have COVID or whether they have malaria. But at the beginning in 2020, people were scared to go to be tested because they didn't want to be found positive. But I think now people are learning that it is important that one gets tested. And it's only by testing that we're able to differentiate the symptoms of malaria and COVID itself.
Yeah. This is a question for you, Dr. Willis Akhwale. Is local manufacturing a guaranteed approach to decrease cost of drugs, knowing the raw material may be imported?
Yeah, thank you for that question. Obviously, there will be teething problems, but it is until you have situations like we've gone through COVID that you start realizing that you may have the potential. For example, the artemisinin plant can also be grown here in Africa. There could be raw materials that can be produced in Africa. I think it's incumbent upon African governments, especially those that have a high burden of malaria, to look at the tax regime. Because in a country like Kenya, we have this situation where the imported malaria commodities do not have tax on them, but the raw materials that will be used for manufacturing have tax. So a balance that has to be reached. I know we don't want to increase that, but incentives that will ensure local manufacturing, which is going to be more sustainable in the end, is what we need to look at. Thank you.
Thank you. For you, Gabriel Jr., Mozambique's End Malaria Council and Fund successfully mobilized over $3 million to help close gaps in the National Strategic Plan. How did you achieve this?
Eu estou à espera da tradução.
I'm still waiting for the interpretation. I'm still waiting.
Interpreters.
I couldn't hear your question.
Should I repeat the question again? Mozambique's End Malaria Council and Fund successfully mobilized over $3 million to help close gaps in the National Strategic Plan. How did you achieve this? Did you get the question there, Gabriel?
Então, ouvi.
Yes, I heard the question.
Great.
Ouvi aí o meu bispo, o homem.
I heard Mr. Bishop, the man of God. He talked about that Sunday, the World Malaria Day, and when he talked about that Sunday, I said, wow, that was the most important day or Sunday in my life, because I had never participated in a movement in which we raised so much funds for malaria, such as that particular and blessed Sunday. And what did we do? So I want to say that that day the Prime Minister was there, and he was amazed with the amount of support, because we had announced it the day before, $2.6 million in private sector support. So for you to have an idea, we so far have a promise of about $3 million from the private sector. This is something that has never been seen. And what we did is we approached all of the companies, oil and gas companies, private sector companies, from the smallest one to the biggest ones. And we told them, ladies and gentlemen, the malaria cause is not only affecting the country or the population, it's also affecting your company, your business. You are part of this movement. So calculate and see how many workers at the end of a particular year are out of their workplaces, and this is affecting your productivity. And this way we started to make them aware that it's not only COVID, it's not only malaria, it's not only HIV, it's also malaria. It's not only HIV, COVID, it's malaria too. Malaria, the issue of malaria must be on top of everyone's desk. And we told them, calculate how many times you received a letter of email of a worker that said he couldn't come to work because he was sick with malaria, or because one of his or her relatives had malaria, or because he lost a loved one for malaria. And see that what you are contributing, isn't the amount that you are contributing a smaller amount than what you are actually spending when you have a worker that cannot come to work because of malaria? So this is how we started to sensitize people, and one by one they started joining our cause, and we had a package that also included the media. Each donor that committed on joining this movement of support to malaria. So each donor, we brought them to the media and they spoke, and it created a domino effect. And so if an oil and gas company said that they were going to join, as soon as they said they're going to join the cause, another company would call us, and will call us, and this other company will also commit on helping us. And then we started having dinners, meals, and ambassadors, everyone to work in order to help us. It was a domino effect. And until now, we did not stop. And we had our first conference. We involved leaders from all sectors. And then little by little, we start convincing them through our programs. And they start looking at the media reports and the report from conferences, and they start seeing the importance that there is in the fight against malaria.
This is great. I mean, there's obviously such wonderful things happening in different areas, different parts of the continent in the fight against malaria. And of course, you know, we had such good news yesterday about China being certified malaria-free by WHO. Let's hope that these, you know, that we'll be able to celebrate these similar success here on the African continent too. I don't know whether I would, I'd like to call upon a few comments on this. Let's bring Joy back. Gentlemen, please stay on camera. I'd like to bring Joy back to kind of talk a little bit or to comment about, you know, China's success. Joy?
Yeah, absolutely. In fact, in my you know, work around in development agencies, I have been to China several times. And I have been to the areas of China which were malaria endemic. You know, China basically did everything. And this is one question, I think one of the questions that we're asked about, what about the other sectors? You know, with the environment, you know, public education, water management, agriculture, that are actually you know, contributing towards management or mismanagement of potential breeding sites for the mosquitoes. What are we doing about them? Are we just coming in with, you know, interventions and not actually trying to get other sectors to support the health sector? And I think the trick here with China was that every single sector was involved, and there was full public education. Every single farmer knew how to ensure that the paddy fields that they use for planting rice did not contribute as did not contribute as breeding sites. And every school in a malaria endemic community, they actually engaged the students, the young people, in the fight against malaria. It was part of the public education, and it was a requirement that as an out of school activity, you actually participate in the fight against malaria. So it was all hands on deck. And I think that's the most important lesson for us in Africa, that all hands on deck works.
Well, certainly can't argue with that. Unity is strength. I must say, we have run out of time, unfortunately, but I'd like to say thank you to all our speakers and, of course, to the attendees for your active participation. There were so many questions in the Q&A box there. I don't know whether panelists can actually just go in there, perhaps type in a few responses so that the attendees don't feel left out. So again, thank you very much. Let's now hear from the CEO of the RBM Partnership to End Malaria. A warm welcome to Dr. Abdurrahman Diallo for closing remarks.
Excellencies, ladies and gentlemen, July 2nd marks the 3rd anniversary of Zero Malaria Starts with Me, the Pan-African movement aiming to strengthen our local, national, and regional efforts towards a malaria-free Africa. What began as a grassroots campaign in Senegal, Zero Malaria Starts with Me has turned into a continent-wide force coordinated by the African Union Commission and the RBM Partnership to End Malaria. The campaign encourages all citizens, political, business, community, and religious leaders, as well as individuals, to make a personal commitment to end malaria for good. In just 3 years since the African Union leaders endorsed the campaign, Zero Malaria Starts with Me has expanded into 20 countries across the continent, with more on the cusp of joining. Based on the pillars of political, private sector, and community engagement, the campaign has helped generate the highest level of attention and commitments for malaria elimination. This includes establishing national End Malaria councils and funds with support from the African Leaders Malaria Alliance and private sector collaborations such as Zero Malaria Business Leadership Initiative, spearheaded by the Ecobank Group and Speak Up Africa. As we have heard today, we have an estimated funding gap of more than $2 billion a year needed to reach continental and global malaria goals. That's why resource mobilization from both public and private sources is becoming increasingly urgent, especially as the world is grappling with the devastating impacts of the COVID-19 pandemic. Malaria has a huge burden on the health and well-being of individuals, families, and communities, but it also has a profoundly negative impact on the economies due to reduced productivity, employee absenteeism, reduced household purchasing power, and increased health expenditure. This is why anti-malaria councils and funds are critical in the fight against this disease. We encourage other countries to follow the great examples highlighted during today's discussion, adapt this strategy to their local settings, and help us reach the target of 15 national End Malaria councils and funds by the end of this year. Finally, today we've been reminded that the key to success in the fight against malaria is leadership. Leadership from presidents, leadership from the private sector, leadership from our frontline health workers, and from every community in countries affected by malaria. We need to ignite a society-wide movement to end malaria. We look forward to building on our efforts with our partners, countries, businesses, and communities to implement tailored zero malaria programs and realize our shared vision of a malaria-free Africa and malaria-free world. Today, more than ever, zero malaria starts with each and every one of us. I thank you.
Thank you for that, Dr. Diallo. And of course, as we've just heard, committed leadership across all levels of society is the key to smart investments and for reaching zero malaria. We've heard some of the encouraging progress is within reach during this session. Let's continue the conversation tomorrow on the campaign's 3rd anniversary and declare Zero Malaria Starts with Me. I thank everyone for joining us and have a great day.